From crying to colic to gas, here's what you need to know about baby tears, plus a few calming techniques that may help soothe a fussy infant. After feeding and diapering duties, soothing your fussy infant can seem like it takes up the bulk of your day and most of the night. Crying and babies go hand in hand, of course, since kicking up a fuss is the only communication skill newborn knows. Yet a baby's cries can quickly overwhelm, especially when you can't figure out why she's so upset in the first place. The first step toward learning how to soothe a crying baby is to approach the task as calmly as possible, since getting worked up only compounds the stress for you both. To help your wee one settle down, here's a look at some of the most common reasons babies cry, and how to comfort your infant. It's the age-old question that parents have been asking since the beginning of time. Why the tears? To help you determine why baby is crying, check out what could be behind it. Hunger. 4 newborns take a bottle every few hours, 8 to 12 times in a 24-hour period. If your baby's crying, there's a good chance she's ready to eat again. Look for signs of hunger like lips smacking, bringing hands to her mouth and rooting to feed baby before tears begin. Gas. Gulping lots of liquid can trap air in your baby's belly, making her uncomfortable and fussy. To fix this problem, burp your baby after every feeding with gentle pats on the back to relieve gas. Wet or dirty diaper. No one wants to sit in wet or poppy pants. Infants create as many as 6 or more wet diapers a day, so check her tiny bum frequently. Fatigue. From day 1 to month 3, newborns sleep about 14 to 17 hours in a full day in spurts of 2 to 4 hours. Lay baby down to rest if you think she's due for a snooze. Colic. Excessive crying could be colic. Ask your child's pediatrician if you think her crying might be excessive. Boredom. Yup, babies get tired of sitting and looking at the same old scene. To quash the boredom, pop her into a front carrier, sway in a glider or rocking chair, stand by the window, go out for a walk, or just stroll from room to room. Overwhelmed. Retreat with baby to cuddle quietly, away from people and noise. Sucking on a pacifier also soothes. Or you can try swaddling her in a light blanket so she feels safe and snug. Hot or cold. Layers work well when dressing baby, but too few or too many can leave her uncomfortable and in tears. Check her outfit to see if you should add or subtract a layer. Sick. Lastly, crying is sometimes an indication that baby isn't well, so check in with her pediatrician. If you suspect she might have a fever, check her rectal temperature. Crying is completely normal for a baby. In fact, you can expect to hear 2 or 3 hours of fussing a day during the first 6 weeks of baby's life. So once you know that crying is just a part of being a baby, the next step is figuring out if the cries you hear are run-of-the-mill cues: hunger, fatigue, dirty diaper, and this takes some practice. Once you've nailed what each type of cry sounds like, you'll know that the fussing you hear is likely normal. More intense wailing and screaming, however, may indicate an unusual level of crying that could be colic. If your child is crying excessively, discuss it with your pediatrician. She may need to be evaluated to make sure there isn't a medical cause. If her pediatrician suspects colic, they can recommend what you can do to help. Crying that's weak sounding and comes across like soft whimpering could mean baby is sick and can't muster the strength to cry loudly. Call the pediatrician so you can describe baby's symptoms and learn how best to treat any illness she may have. The pediatrician may tell you to bring child in for a checkup.